Well, as President Donald Trump continues his attempts to remake and shrink the federal government, many of the nation's veterans are wondering what potential changes to the VA could mean for them. Scripps News White House correspondent Haley Bull had a chance to ask that question directly to the Secretary of Veterans Affairs, Doug Collins. And Haley, what did you learn?
Yeah, hey, good afternoon, Andrew. Well, as the Trump administration is approaching its 100 days in office, Secretary of Veterans Affairs Doug Collins is touting an effort to streamline the agency and focus on veterans. Secretary Doug Collins settling into his role leading the Department of Veterans Affairs. What changes can we expect to see at the agency under your leadership?
Well, one of the biggest changes is a focus from the VA being sort of a centric focus around itself and then not the veteran. And we've changed that to where the veteran is our focus, that we're a service organization. And that's what we're going to do. We're going to service the veterans and the needs that they have statutorily and what they've earned. So our health care benefits, the benefits, disability benefits, education benefits, housing, all those kind of things. So we're very much focused on customer service. And I think what you're really seeing now is the biggest difference you're going to see is a streamlining and really a focus on making sure that everything we do in the VA is efficiently service toward that veteran process.
The administration has sought to trim the federal workforce across agencies. Secretary Collins says 80,000 at the VA is a goal.
Because we're never going to put in jeopardy patient health care or the disability benefits getting to the people who need them, the veterans who have earned them. And so what we're doing right now is making sure that an agency, which by the way has grown over 100,000 people and over several hundred billion, almost a couple $100 billion in the last 10 years, is doing it as efficiently as it can. But what we're seeing, unfortunately, is our numbers were not showing that. In fact, our wait times were not moved a lot. Our backlog actually went worse after COVID. And frankly, the GAO has said that we're on the high risk list for, the waste and issues of personnel and patient care. So we're making sure that we're putting the right people in the right places. And that may, mean a downsizing of bureaucracy and layers. Right now, the VA has become, frankly, the poster child in many ways for a bureaucracy.
And as you're looking at this, as you're going through this, can you guarantee that the downsizing, as well as the review of contracts that I know is undergoing, won't impact things like telehealth support, the speed of claims processing, appointment booking, research, the support for medical staff to carry out their jobs, things of that nature?
Yeah, no, that's exactly what we're working to improve by looking at our department and looking at how we're actually structured. Are we using computers more and our information technology in a better way that can actually process claims quicker, get those out to folks? Can we get more appointments in? Can we put more doctors and nurses into the facilities? You mentioned contracts, and I'm really glad to talk about that because we were able to move over $300 million out of contracts that were basically administrative contracts for PowerPoints, meeting notes, things like that. And we moved over $300 million into our community care patient network, which that is something that helps our patients directly. So we're actually making it better because frankly, there's this line out there that everything was okay. Everything wasn't okay. And frankly, the GAO said that.
Can you guarantee, as you're looking at the reforms in the agency, that the benefits provided through the PACT Act will stay intact for our service members?
Yeah, that's easy. That's statutory. I mean, they're going to get the benefits that they've earned. Again, we're looking at our own efficiency and procedures internally. But the PACT Act, what's interesting is a lot of members of the Hill, senators and congressmen as well, want to talk about the PACT Act and how they've increased our, workload and everything else. What's really true and what we found is that I've also looked at the number of veterans. By the way, the number of veterans in that 10-year period for the GAO in the last 10 years, our number of veterans in our country has went down almost 5 million total, and our number of veterans served or accounted for in the VA system has been steady at about 9 million. So we have we have some new ones coming in. We have, of course, those who are leaving the system through death and others. So we're not really, frankly, seeing a huge surge, but what we are seeing is a lot of benefits being paid out to those who've earned those benefits and what the PACT Act said that they were going to get. So that's not changing at all. And let me make it also very clear. There's a lot of misinformation out there saying that we're cutting health care benefits and we're cutting disability benefits and those things. There couldn't be anything further from the truth. When you're set up and that's how we actually operate, none of those are actually even discussed or even partial. They're actually just out to scare veterans and to scare others. And I'm just trying to put out the fires to say that's not even happening. We're trying to actually make it easier for the veteran who's earned that benefit to get it.
Is there any world in which the veterans' health care is privatized?
No. And that would take, again, for people who want to privatize it, I understand because they've had frustrations with VA healthcare over time, and that is understandable in many ways, but because of some of the issues we had. But if you were to take the VA out of the equation, which it'll never be, let me just rephrase that again, it'll never be taken out because there'll always be a VA for the veteran who needs it. And you put that 9 million people onto the healthcare system of the United States, there will be no way in most communities that they could handle the burden.
For Collins,
when people don't want to see any change, it tells me they sort of like the VA as the whipping post, but we're not going to be the whipping post anymore. The VA is going to be an organization that veterans can be very proud of.
and Andrew Collins also told us the suicide rate among veterans is too high. He encouraged veterans to reach out to their colleagues and direct them to the VA and the Veterans Crisis Line, which is 988, then press 1. Andrew?
All right, Haley Bull in our D.C. newsroom. Haley, thank you.